Hi everybody, I'm Dr. Jordan Williams. Today's 3-minute injury report is about knee pain while hiking. What is it, why it happens, and what you can do to help fix it. Have you always wanted to hike the Grand Canyon, but you've never been able to or never wanted to because you have such knee pain when you hike, especially downhill? You want to go on to Indian Gardens, hike Bright Angel, really live out your dream? Well, don't let that hold you back anymore. We want to help you with that knee pain. Well, let's talk about why you have knee pain when you're hiking, what happens and where it comes from. Let's draw the anatomy first. So if we take a look at the knee, this is where the patella is, or the kneecap, and this is where all the muscles attach right below that. Well, those muscles actually attach or begin up in the hip here, right above the hip, and they come all the way down. When you're hiking and your knee drops in or out, what tends to happen is these muscles get stretched in one way or another there, and they get really, really irritated. Well, there's a couple of things that you can do for that in order to help to decrease the amount of irritation that is in the knee while you're hiking. The first thing to do is to think about how you're stepping, how you're standing, how you're walking up and down. The easiest way that you can help with this is find something that you can step on, step up, like a step, or our favorite pathology books that are super thick, and go ahead and just use that as your step. And you're going to step up, keeping in mind that hip, knee, and middle toe alignment. As you do that, you want to think about using the muscles in your butt to rotate your knee out so that this whole alignment happens. So what you're going to do is practice this 15, 20, 30 times a day, making sure that that knee stays in line each time. Next, you're going to do the second half of that because you can't get to the top of the Grand Canyon without having actually gone down to the bottom first. So while you're doing that, you want to break it up into the first one, and then you're going to break it down into the second part of that. You're going to step down and tap your foot right at the bottom, and then come back up. Again, making sure that the hip, knee, and middle toe are in alignment the whole time. As you're doing this, again, engage these muscles on the outside. Try and rotate that out so that you're nice and stable within the leg there. You don't want to see this. You don't want to see this hip dropping in. You want to see level hips dropping down there. Those are the first two exercises that can help with that. The last one is the most basic exercise that a lot of people do when they think about hip or knee pain, and that's clam shells. When you do clam shells, you're just going to stack your hips and stack your knees, keep it basic, and then just lift that knee up and back down. Keep your knees bent, keep your hips bent, and when you engage here, you're going to really start to strengthen these muscles. These are the muscles that move that knee in space, and they're going to be the ones to help you decrease those really bad biomechanics when you're going up or down. So try these exercises. Try them for a couple of weeks. The results won't come super quickly because it's a strength thing, and you want to build strength up over time. But go out and hike. Try to practice these things when you're hiking. Try to think about these things. And if you do these things for a couple weeks and you start to notice a little bit of difference, even 4 or 5 weeks, and you notice some difference, we'd absolutely love to hear about it. If you're kind of struggling because there's still some pain with the step ups and step downs and the clam shells, absolutely we'd love to hear about that too, because we'd love to get you in here and help you get on that dream vacation where you go hike the canyon and live that out. So we hope to hear from you soon, and thank you very much.